Hello, my name is Dr. Dewan S. Raja. Today I will discuss about gout. What is gout? Gout is a form of inflammatory arthritis that occurs when there is an accumulation of uric acid in the blood, leading to the formation of crystals in the joint. So, we have inflammatory arthritis, that is inflammation of the joints, and also high uric acid level in the blood that forms the crystals in the joint, that is gout. Uric acid is a waste product that is normally excreted through the kidneys. In some people, the body either produces too much uric acid or the kidneys are unable to excrete efficiently. The accumulation of uric acid crystal in the joints can result in sudden and severe pain, swelling and redness. Joint of the base of the big toe, the joint we call it first metatarsophalangeal joint, is a common location for gout attack, although other joints can also be excreted. So uric acid, very important point here. Joint pain, severe pain, usually in one joint at a time, and uric acid is a waste product from purine metabolism. So food rich in purine may trigger gout. Okay, you got that? So pathogenesis, we have hyperuricemia, uric acid level is very high, precipitation of urate crystals in the joint. So phagocytosis by macrophages, and this is a synovial fluid. This is a part of most likely a big joint, maybe a knee joint, cartilage, articular cartilage, bones. So what happened? The crystals are engulfed by the macrophages. There will be release of inflammasome activation and interleukin-1 release. Okay, that will also incite the neutrophil recruitment and also phagocytosis of crystals by neutrophil and release of crystal after phagocytosis or lysis of neutrophil that may happen. Here, inflammasome activation and interleukin-1 release, lysosome rupture and release of mediators to the joint. So that will be pain because lysosome containing the acid substance and also the breakdown product of the crystals, okay, or that will release mediators like cytokine that will cause inflammation in the joint. Okay, release of lysosomic enzymes, there is injury and inflammation. Okay, so what will happen? There will be inflammation due to the inflammatory injury. Pathogenesis of gout, we can classify, we are continuing pathogenesis. Two types, primary gout, secondary gout. Secondary gout around 10%, primary gout 90%. Cause may not be known in many cases, unknown enzyme defect, or it may be partial enzyme deficiency, primary gout, but mostly unknown enzyme defect. Secondary gout, increased nucleic acid turnover, that is in leukemia. Patient with leukemia have more chance to have gout. Chronic renal failure, congenital problems like that of Leigh-Lehmann syndrome, HGPRT deficiency in this syndrome. Okay, a Lesch-Leyhan syndrome. So that a psychiatric disease, congenital, and there will be deficiency of AGPRT. This is enzyme. Okay, drug, some drug like that of diuretics that may incite the inflammation of gout. Complication of gout may be many, including arthritis, usually one joint, but then eventually multiple joint. Okay, renal stone because of deposition of the substances. Okay, so there will be stone, pyelonephritis, and urinary obstruction. These are common. These are the complication. So these are the secondary causes, like increased nucleic acid turnover, chronic renal disease, congenital Nyhan syndrome. In this condition, AGPRT is deficient. Complication of drug like that of the furosemide or a few other diuretics may aggravate the gouty pain. Arthritis, renal stone, these are complications. Pyelonephritis and urinary obstruction, it is a complication. These are the complications: arthritis, renal stone, pyelonephritis, and urinary obstruction. Uric crystals are needle-shaped. These are the crystals, and negatively birefringent under polarized light. Okay, we got that. In our previous picture, we have seen macrophage, neutrophil. We have some type of inflammatory substance. Also, there is some substance from the neuron. Okay, so this is this, and we have two type of cell is working. One is macrophage, and another is neutrophil. Okay. Okay, we got that. Now we'll go to the primary gout, secondary gout. We just discussed that. Then clinical features of gout. Initial attack on a single joint, suddenly, often at night, with excruciating pain, hyperemia, swelling, and mild fever. Single joint, usually first metatarsophalangeal joint at the base of the big toe. Mainly, this is of lower extremity. Classically, the first metatarsophalangeal joint, podagra, is affected. Most common sites are extensor tenosynovium of the dorsum of the midfoot, the knee joint, elbow joint, joints of the hands and feet. Attack may happen after a purine-rich feast. Illness or surgery. Exhibit all the classic signs of acute inflammation like color, dolor, fever, remor, loss of function, like that. Okay. Exquisite soft tissue tenderness, fever, and tachycardia, eventually deposits of uric crystal in the subcutaneous tissue. What happens if it is untreated? Untreated acute gouty arthritis may last for hours or weeks, but gradually there is complete resolution followed by symptom-free interval known as the intracritical period. Chronic trophaceous gout develop about 10 years after the initial acute attack and is characterized by trophaceous gout, and is characterized by juxta-articular bone erosion caused by osteoclastic bone resorption and loss of joint space. We just have seen that. Okay, this is the joint that is undergoing changes by the inflammatory process. Okay, so we got the clinical feature. Now we'll go to the risk factor for developing gout. Diet, consuming diet high in purine-rich food such as red meat, organ meat like that of the gizzard, liver, and certain types of seafood. Seafood maybe sardine, okay, can contribute to elevated uric acid level. Genetic, a family history of genetic increases the risk of developing the condition. Medical condition, certain medical conditions such as kidney disease, diabetes, hypertension can increase the risk of gout. Medication, some medications such as diuretic like Lasix, furosemide, can interfere with the excretion of uric acid and increase the risk of gout. Remember, many drugs may lead to gout. Okay, so not necessarily one drug, multiple drugs may cause gout. Lifestyle factors such as obesity may incite the gout. Excessive alcohol consumption should be curtailed as much as possible. Diagnostic test, joint aspiration, presence of negatively birefringent crystal in the synovial fluid. We have seen that crystal. Okay, so we'll get crystal here in our work. This is the crystal, that is urate crystal, needle shaped, this is needle shaped, and negatively birefringent under fluorescent light. These are the needle shaped structure, a lot of needles. Okay, we got that risk factor, we have just gone through that part. Diagnostic test, joint aspiration, presence of negatively birefringent crystal in synovial fluid. Chemistry panel reveals elevated serum uric acid. CBC indicates leukocytosis and high ESR. Leukocytosis because it's an inflammatory process, and we have the RBC, maybe stack roller formation in erythrocyte sedimentation rate. Radiograph, soft tissue swelling, and in chronic cases tophi or erosion punched out of the lesion and joint destruction. This is very important. Swelling and in chronic cases tophi or erosions. Treatment of gout, management and treatment of gout typically involve addressing both the acute symptom and the underlying cause. This may include the acute condition. Management may include medication to reduce pain, inflammation, okay, colchicine and steroid. Each of them has adverse effect, and NSAID, colchicine, anti-gout drug, but it has also some blood adverse effects. And steroid may lead to Cushing-Gout feature for long-standing treatment with steroid, as well as medications to lower uric acid level in the long term. Okay, we got that. Lifestyle and obesity changes such as maintaining a healthy weight, limiting alcohol intake, and avoiding purine-rich food can also help manage the gout. Please subscribe me, share the information with your friends. Have a nice, wonderful and blessed day. Bye now.